Hi, everyone. Depending where you are in the world, good morning, good afternoon, good evening. Welcome to day 3 of the Seneca Digital Health Hackathon. My name is Avi. I'm part of the organizing committee for this hackathon. My team and I know how hard you've all been working these last couple days, and we're really excited to see the outcome of that work. Thank you all for dedicating your time this week working to create positive change across the different areas of digital health. Over the course of the next hour or so, we have two wonderful speakers from two of our sponsors, Markham Stouffville Hospital and CAMH. Starting us off for today is Lorinda Lee. Lorinda is the Chief Human Resources Officer at Markham Stouffville Hospital. Lorinda has over 25 years of experience in HR, including, and this is a very extensive list, so get ready, employee and labor relations, HR systems, compensation and benefits, investigations, human rights, change management, performance, engagement, organizational effectiveness, occupational health and safety, talent management, equity and inclusion, as well as coaching and mentoring. Lorinda held a BA in psychology and a BA in education, master's in intercultural communications, CHRO designation, and has a PhD in applied management and decision science. Lorinda is always looking for ways to improve herself and organizational systems, and is passionate about supporting people to develop and grow. Lorinda, welcome. We're very happy to have you here.
Great, thank you. Hi, everyone. So I thought it might be fitting for me to provide a little bit of tips on preparing for a successful interview. And I'm going to provide 4 tips to count down, and hopefully you'll find this helpful. And I do have some time that will be left over that I'm opening up for question and answers in case anyone is interested in asking me any questions about it. I can certainly share my personal experience, both from a candidate perspective and from a panel perspective on the other side, asking candidates questions. And I'm hoping to also make it interactive. And I have a couple of books to give away that I think will be quite helpful. And it's, I don't know if you can see, so, oh, it's my view. So anyway, it's actually a book called Crucial Conversations that professionally I have found it very, very, very helpful. So for those who are interested, do use your chat function as I'm going to ask. There's one segment where I'm going to ask a question and see who will be the winner. So I'm going to have to ask Abby to help me moderate that, to tell me who, I guess, the name of a person and what their answer is, so we can determine who is the winner. Okay, so in terms of the 4 tips to count down to have a successful and preparing for a successful interview. So in terms of obviously, the first thing that we all have to do is the resume, right? So when you're looking at a resume, you look at the job posting and look at what they're requiring the candidate to possess. So it's important to analyze what they're actually putting on there in terms of requirements. And of course, from a candidate standpoint, you're trying to make sure that when you're putting in your resume, you're going to hit all the right points. Now, I know that most people will use the same words, and from an AI screening perspective, the same words may get you screened in. The important part, though, is if you're saying the things that you have. So, for example, someone might say on the posting requiring project management experience. If you just have one line in your resume and cover letter that says, I have managed projects, but did not demonstrate it in the resume, that will probably not be very helpful in terms of the screening. You have to be able to demonstrate how you meet that requirement. So that's important. And also, it's important to look at the organizational information on the website, see whether you can find out what projects they're working on, what are their values and mission vision, which is also important because sometimes you will have 1 or 2 interview questions that will ask you that. It's almost testing to see if you check us out, you know. And of course, there are different personalities, and when we decide whether we apply to jobs. So some people who are more, I guess, humble, and they might look at a job and say, oh, this is like out of my league and I'll never get this job. I actually am of the opinion that we should always try to apply to a job that you actually do desire, even if it's in the future, and try to see what opportunities you might get. It doesn't hurt to put an application in, and if you get an interview, that's even better, right? So don't be afraid to apply to jobs. And when you're looking at jobs where it has all the requirements listed and you feel like you're not meeting all the requirements, you know what? That's okay. You try your best to meet and demonstrate most of the things that you're able to do, and then where you do not have anything to say to in terms of one or two requirements, I think that's okay too. And if you're getting calls for interviews, that's perfect. So here's a tip for people who apply to a lot of jobs and you're not getting, now you may be applying for 50 jobs and you might get one interview. That's not abnormal. I work in the public sector, and often every single job we post, we could have upwards to 200 or 300 applicants. So, you know, you never know where you may or may not be able to get an opportunity. But here's the thing, right? If you're applying to, say, 100 jobs and you didn't even get one call, then I think that's actually a sign that your resume is not working. And so you need to go back and look at your cover letter, your resume, and see how much you need to tweak it. And depending on the job types that you're applying to, like you might be applying to the same kind of jobs and your standard template could work. However, if you're applying to different jobs that are kind of different in roles, you may have to be more customized in what you're putting in your cover letter and resume for each of those jobs. So that's, of course, the first step. So in terms of the next tip is during the interview. So you get called for an interview, which is great. That's definitely a milestone in itself. Now, in terms of preparing for interviews, certainly anyone that they call to be interviewed, you're competing with people who have the same skill level, if not the same or better than you. So in order to prepare and make sure that you can rise above the occasion is how you prepare to go into an interview. So most of the time, the interviews that I am involved in, they ask what we call behavioral questions. They will ask you things like, can you tell me a time when you lead a project or participate in a project? Can you tell me a time of when you have to test this program? So they will be asking you for examples of your experience. Now, having said that, before I dive into that, don't forget about the skills that they might be requiring. Because I recently actually provided some advice to a friend of mine who is going for a public sector interview for an accounting role. And I kind of gave her the tips of this, which is the competencies, preparing for examples. But she got kind of sidetracked because they asked her like actual accounting skill question that she wasn't preparing for. So don't forget to make sure that you have those down pat, especially when most of you are technical and they might ask you technical questions, right? But on the other hand, from an HR standpoint anyway, it is important for us to sift out, you know, your character, who you are, and your values. So a lot of times this comes through when you share examples of what you have done. So these are what we call competencies question. So one of the best way to prepare for these questions when they ask you, tell us a time when you deal with a difficult customer or something like that. What you want to plan beforehand is think of all the examples you can think of when you have either in a work situation or in a voluntary role where you have come across difficult people and how you dealt with it. So making sure that you have, if the more examples you have in your bag when you go into the interview, the better. The tricky part is when they ask you the question, you have to kind of figure out, okay, which of these examples do I want to use? So what you want to do is figure out, based on that job, based on what you know about the organization, what are those competencies that they're looking for? They might be looking for customer service skills. They might be looking for project management skills. They might be looking for working in a team. They might be looking for organization. So think of what they will be asking you and wanting the person to possess. And based on those lists of things, you prepare different scenarios and examples in real life, right? It's your experience. And then if you have at least 2 or 3 examples for each of those things that you think they're going to ask, then you have a good bag of tools and tricks to pull from when they ask you the question. And it's important to use the STAR model, which most of you may have known. So if they ask you a question, sometimes it'll be explicit and say, tell me a time when you manage a project or deal with a difficult client. Tell me about the situation, what you did, and what was the result. But other times they may not be so explicit in telling you to tell them that, but you still should tell them that. What's the situation? What did you do? What are the tasks that you did? So what actions that you took, and what your role might be, and what was the result? So you still want to make sure that you give them that context and the story. So that's tip number 3 in terms of preparing for the interview itself. So tip number 2. So, let me just go back. So I didn't want to give you, so in terms of tip number, the next tip is on communication. So I'm gonna put this questions out there so you can use your chat box if you're interested in winning a book. So in terms of communication, what do you know, what are the 3 types of communication that is essential? So if you can put in the chat box, and Avi, can you like shout out to me what people are saying? No chat?
Nothing yet, but.
Nothing yet? I'll give it a second. If not, I'm gonna pass and then still send you the books, and maybe you guys can give it out.
We got from Soham, we got verbal are 2 types of communication.
Okay, so since that's the first person who won, so we'll deem that person the winner. So if you can mark that off, and sure, we'll move on. Thank you. So I'm gonna let me just, so the 3 different forms of communication: verbal, nonverbal, and written. So that is actually quite important. So in the process of communication or applying and presenting yourself, just be mindful of that, even in text, because sometimes I'll say, there are so many candidates who came across where we communicate with from an HR perspective through emails, and whether intentional or non-intentional, sometimes people come across rude, right? And that actually doesn't help the process, because I could say, well, I don't know, that person seems a little rude. I don't know if they'll fit our organization. So you have to be careful when you are going through the process. Even before you actually get a job. Of course, not to say that should always be mindful. We should always be mindful of that. So when you're in an interview, I'm just going to put everything up. Okay, so when you're in an interview, it is important to make sure that you understand the questions, right? So from a verbal communication perspective, we want to make sure that we're able to articulate our answers and thoughts in a succinct manner. So that sometimes takes some practice. It took me years to try and make sure that I don't start babbling or go on a tangent. And more importantly, answer the question. You won't believe how many times when I'm on the panel asking a question and the candidate would give us a long answer, but it actually didn't answer the question. So it's important for you to make sure that you understand the question. And if you need clarification, don't hesitate to ask for clarification. And then the practice of making sure that you're able to articulate that. So if you're preparing with your example of when I'm dealing with a difficult client, then you can practice in your head or verbally at home how you might share your example, and that will help you to stay succinct and put your thoughts out articulately. And then of course in written communication is the same thing, and the grammatical error, it's important to make sure that we watch out for that. And it's also important to make sure that when you're answering verbally and when you are talking to someone verbally, what you intend for the message to be received, like are they actually hearing what you're actually trying to convey? And that's really putting it's coming at it from their perspective, not your perspective. And that will take some time to get used to as well. Is sometimes it's about framing an answer or framing your piece to what you think they want to hear, right? So there's a difference between what you want to say and versus what they want to hear and they need to hear. So you have to think about it in that way to help you be more successful. Now, the nonverbal communication is also important, and is actually probably, if not more, just as important as the verbal. It's more difficult over Zoom now virtually, but it's still an important part. And I know that power posing is a little bit of a controversy over the last couple of years. But for those of us who may be a little bit more shy and a little bit more reserved in terms of public speaking and presenting, I would say try this, right? Like if you want to do that now, stand up and do a power pose, right? Power pose is like, you know, look at those kids that I have on the poster when they are trying to stand up straight and making sure that you are projecting, you're able to project, and that actually changes a little bit of your confidence level. And there's research that actually talks to that as well. And I actually do that because I want to make sure that I'm putting myself in the right mindset when I'm trying to present, right? So I'm actually, you can't see it, but I'm actually standing right now. So it gives me a little bit of, instead of me hunching over, sitting down, it's at the power posing before. And when I'm in person interview, one thing that I always do is when I'm sitting on those boardroom chairs, I actually raise it to the highest level. Instead of being sitting low, I prefer to sit high. So those are the things that help. So I put on here the 7 C's of effective communication for your reference as well. And I know the slide deck will be shared. So yeah, hopefully you'll find that helpful. So number 1, right? Like don't give up and keep going. Like that's important. Failure is a tuition you pay for success. I think whenever you go on an interview and whenever you reflect on the questions asked and how you've answered those questions, I always I ended up thinking a lot about it, and then I'll think, oh, I should have said that, or I shouldn't have said that. I think those are important learnings that you can take because it is conceivable that you're applying to similar jobs. So the questions that you get asked may be quite similar. So if one interview is not successful, you can learn from it and make your skill and hone in on those skills and correct it the next time. So don't get too beat up and don't get discouraged and keep trying and use those opportunities as learning opportunities, right? So, I mean, I'm sure you know about this. The success is only the tip. All the hard work that you go into is really the important part. So don't forget those pieces and just don't get too beat up and continue and keep trying. And here are just some tips on, you know, how we can build our resilience through that and, you know, and celebrate. And don't forget that if you actually get called for an interview, you might be 10 people out of 100 people. And that in itself is a great accomplishment. Don't get too beat up on that. And sometimes timing is everything, right? Be honest with ourselves and work at it as you go. And I'll share just a personal example to close before question and answer. You know, I applied to my current job as a chief HR officer actually 2 years ago, and I didn't win the job at that time. And 2 years later, I had the opportunity again. And I think what I did in the first time 2 years ago actually helped pave my path. And the experience that I gained over the last 2 years before I got the job actually prepared me even better for the job. So sometimes you never know what opportunities bring when you go on one interview that was unsuccessful, but it could lead you to the next job too. So I'm going to open it up. I'm going to stop share now. Hang on, how do I do that? Stop share, and then I will open it up for questions.
Everyone, you can type your questions in the Q&A box or the chat, and I'll read them out to Lorinda. Also, Lorinda, in the Q&A box, there's another section there. We got a couple other answers. So one, Vlad also said nonverbal communication, and Josh said inbound, outbound, and internal.
Good. So there's 3 people, and you know what? I do have 3 books, so I'll send the 3 books over. Okay. And congratulations, guys, and enjoy that book. It's really good.
Lorinda, I had a question. We're waiting, and that is looking forward. What do you think the trend is for the hospital? What kind of resources are in most demand?
Oh, that's a difficult one because I mean we have a lot of jobs available. Certainly, I mean this is not a clinical crew. So, I mean, the top is always nursing roles, and also now PSW is also high in demand, but it's not this group. But there's always opportunities from a technical standpoint as well, because, you know, the technology is a big piece of what we do in the hospital as well. You know, from all the challenge set that you might be dealing with, like, and it's all about digital care and how we can make information more available, which is all technology, right? I mean, the top, being in a hospital environment, the top need are always bedside care. But having said that, we often need other people who are in the backroom too. Like there's HR people like myself, right? So there's always those opportunities.
So we have a question from Ivan, and he's asking, what kind of questions might be good to ask during a job interview?
That's a good question. So, I mean, that's a tricky one. I normally stay away from what's the next step kind of thing. I would, I think sometimes you have to ask questions that are relevant to the job. So I would say good questions might be about, projects. So if, for example, you are, most people here are on the IT, IT technology end, you can probably ask things about, well, so what are some of the big, technology related projects that the organization is working on that this role will be a part of? Those kind of things will be a good question. Or if you see something on the website that kind of might have something to do with the role, then you can ask about that as well. So I would say ask something that's relevant to the role. Like what would be something that this role would be working on? So those are good questions to ask. I hope that answers the question. That's a difficult one because I often spend a good amount of time figuring out what is a good and appropriate question to ask without sounding like, how do I put it? Like I want to ask a smart question, right? So I would say anything that has to do with the role would be relevant. Like maybe how big might my team be? How many people I might be working with? Those are good. Those are okay questions to ask too. So something relevant to the role would be good.
Thank you. So we have another question from, oh wait, were you going to say something?
No, go ahead.
Okay, from Philip. What sort of advice would you give to someone who's applying for a tech job but has no previous experience in tech?
Well, I would say that don't ever underestimate yourself in terms of experience because you're doing this program and you're doing this hackathon, right? So what you have to be able to do, when you say experience, I'm guessing you're referring to job experience, like on the job experience. Like what you want to do is pull out some of these things that you have done. So what are some things that you've built that might be relevant to the job that you're applying to? Or in the hackathon, what you've actually done in terms of creating. So you have to be creative in pulling those things out, even though you may not have been paid for doing that, and that's what you need to pull out. It's if you have any voluntary experience and any projects that you have done, or even when you are doing something for fun, right? So you have to be able to kind of be creative about how to link those other things that may not be a paid job experience to what they're looking for. And it's the same thing when you're thinking about the examples that you might have to pull out, right? So hopefully that helps.
We're getting a few more coming in. So one is, what are some common from Josh? What are some common pitfalls that lead qualified interviewees to not get the job?
Well, sometimes it may not be because of your performance. Sometimes it's who you are competing with. You might be competing with someone who has 5 more years of experience than you have and have worked in bigger organization or bigger projects. So sometimes it's because of that. Other times it's maybe someone didn't answer the questions or one of the questions, right? But because every question is going to be from a public sector perspective, excuse me, every question is marked on its own. So sometimes, because we're very vigilant in keeping score, in the public sector though, that may not apply to private sector. So sometimes people don't actually answer a question because they have already, they feel like maybe they answered it in the last examples and they might say, oh, you know what, I already kind of talked about that in the last example. And then they kind of didn't give as wholesome of an answer. I've experienced that in the public sector because we are required to mark each question kind of like a test. However, sometimes it's just because maybe, you know, the examples that you've given may not be as complex as another person. And a lot of times, you know, it is a difficult, it's an art and science, right? It's also what is your personality and your values that are being put out, because the panel and the organization is looking for fit, right? What is the person that I'm looking for? Skill is easy to teach. A person's character and values is harder. And that is, in my opinion, definitely something you want to bring across, is who are they hiring that will benefit this organization. So I mean, but know that it's not always because of you. It's because of who you're competing with, right? So that's what you have to think about.
That's true. That's very true. There are other people too. So another question from Rishab. Is it okay to reach the HR or other employees on LinkedIn or other social media platforms?
Sorry, can you repeat that question?
Is it okay to reach the HR or other employees on LinkedIn or other social media platforms to reach out to them? That's from Rishab.
I mean, that depends. That depends, right? Because I mean, it depends on what is your intention. Some people, it depends, because some people may not accept because they don't know who you are. It doesn't hurt to try. If you know someone, the best way to go about it is, if you want to know about the organization, is see if you have connections or if you have friends who are there. That will be the best way. Otherwise, you can try it. It doesn't hurt, but you can't. There's no guarantee that the other party will accept your invite. So I think time's up. Or do you still have time for another question?
I think there's time for one more. Yeah, this one is from Mo. If we have a gap in our resume in terms of work, how do we address that issue? Does that hurt the chances of the applicant during the interview?
Yeah, I think it depends on how long your gap is. That's a tricky one. If your gap is short, then you can probably just slide it over and not even kind of put it out there. It will show by the dates. But if you have a long gap, then is it because you went back to school, which will also show in your resume? And then you might want to think about whether you want to do a competency-based resume versus a chronological resume. So I think it'll have to depend on how long that gap is. And the tricky part is you want to make sure that you fill that gap if you think that it becomes an issue.
All right. There are a few more that came in. Would it be okay if we forwarded it to you after, and then you know, we could send it out?
Absolutely.
I want to ask, there was one I like there, and I want to ask this one. What is the best, this is from Christiana. What is the best way to answer the question, what is your weakness?
Sorry, I have to keep unmuting myself. So I would say that you have to figure out how to turn that question from a negative also to make that not so negative, right? I haven't gotten asked that question in a while, but sometimes, like, you do have to think about that, because you don't want to say a weakness that will kind of trigger them to think more negative. So it's about, I have a slide that is really good that I took out from my presentation. It actually shows the weaknesses and the flip side of the weaknesses. So what I'm going to do is I'll share it with Avi and Christiana, so you can put it up. So it's kind of like something like, I would say, okay, so let me give you an example. My weakness, one of my weaknesses, I actually tend to be pretty impatient. But then how I'm going to answer that is, you know, I've learned over time that I have to make sure that I empower and give other people time to deal with work. On the other hand, if something is really urgent, then I find that my impatience help me to come up with and reach the results that I need. So you have to be able to frame it in a way that will be helpful, you know, even though it is a true weakness. So you kind of have to think through it and how you might answer it. But I'll share that slide where it's a book actually, but it is one slide that shows weaknesses and how you turn it around to become to make it like a positive as well.
Thank you, Lorinda. That was really, really insightful, and I'm sure a lot of us here, I know myself, where I'm looking for jobs, and so I hope I and everyone here can use all these tips soon, very soon. They're very helpful. So thank you so much for your time today. We really appreciate it, and hope you have a good rest of your week.
Great. Thank you so much. Thank you, everyone. Bye.
Bye, Lorinda. So Lorinda is from Markham Stouffville Hospital, but next up we have Dr. Nigel Turner from CAMH. Welcome, Nigel. So Dr. Nigel Turner is a scientist at the Center for Addiction and Mental Health, so also known as CAMH. He has spent the past 25 years conducting research on addictive behaviors with a focus on gambling behaviors. He is particularly interested in risk and protective factors for problem gambling, and has developed and evaluated prevention and treatment approaches for problem gambling based on his research. He has published over 100 papers in peer-reviewed journals. Dr. Turner, we're happy to have you here. Thank you for coming. The floor is yours.
Thank you for inviting me. Can you hear me?
Yeah, we can hear you.
Okay, good. Oh, about that last question that was asked, I have a bit of a attention deficit disorder, and I deal with it by giving myself lots of deadlines. And so if I was asked this question, I would say, well, I tend to procrastinate and I leave things to the last minute. So I deal with this by giving myself deadlines and utilize that impulsive fixation on solving problems to my advantage instead. So I've been successful. So it works. So I click share, right? That's how this works.
Yeah, you can click share and share your screen.
Okay, so do you see the splash page for the PowerPoint?
It's loading up right now. Yeah, now
we see it.
Okay, great. Okay, so I've been doing research on pathological gambling or problem gambling or compulsive gambling, whatever you want to call it, for the past 25 years. And I'm going to first go through some of the background research that I've done, and then I'm going to show go through some of the electronic applications that I've used or developed over the years to show how electronic devices and electronic and programming and can be used in healthcare. Now, my specialty is in problem gambling. A lot of the things, all my examples are about problem gambling, but a lot of this applies to other areas in mental health, such as depression or substance abuse or video gaming, excessive video gaming, and so on. So I'm just using gambling as an example, but I want you to understand that it's not limited to gambling. So I have a PhD in cognitive psychology from 1995, University of West Ontario, and I was particularly interested in how people actually reason. We don't reason logically like a computer. We reason with metaphors, analogies, metonyms, idioms. We have all kinds of biases in the way we think, and we have heuristics or informal rules. We believe we have an illusion of control. This comes up frequently in gambling. People think they can win. We believe in luck, and we're susceptible to superstitious learning. Also, people are generally lousy at math, and that's something that the gambling industry takes advantage of. So I started in 1995 doing statistical analysis, promoted to scientist in 1997. ARF became the Center for Addiction and Mental Health in 1998. I've been there a while. I've engaged in research on epidemiology. This is general population surveys, finding out how a disease is distributed in the population. I've done purposive studies where you use advertisement to recruit people. I've done simulation studies, in particular exploring how games work. I've done prevention evaluations and treatment evaluations. A few examples, epidemiology, we did a evaluation of what kind of impact the Niagara Casino had on the number of people with gambling problems in Niagara. I've also conducted a couple of studies. The correctional population in Ontario found that 10% of offenders had a severe gambling problem. Recent study found that head injury were 3 times more likely with people with a gambling problem. So it's been a variety of different studies. 2006, I reported on a study that found about half of problem gamblers report a big win when they started gambling. This fits in with a behavioral learning theory model of pathological gambling. In 2008, I found data supporting the pathways model that there are different clusters of people. So people get into addictions for different reasons. There are people who have no other psychiatric complications, who's caught otherwise normal. They become problem gamblers because they believe they can win. Their parents gamble or their friends gamble. They enjoy gambling. There are people who are emotionally vulnerable. So these are people who gamble just to forget about their problems. And people like depressed, they may be depressed or anxious. And gambling provides them an escape. And there are impulsive people. So that was in 2008 that I actually confirmed that these pathways do exist. 2013, I published studies on addictions in the clinical population, what other people do. Now, my simulation studies are have been using statistical analysis and computer programming to generate fake data to test, like, what are the long-term implications of a particular strategy. I looked at strategies to play roulette and demonstrated that all the strategies fail. None of them beat the odds, and they end up actually increasing your financial problems as a result. In another study, I examined how skilled poker players impact how other people's skill impacts your outcome in poker and sports gambling. And basically, the only way to win in poker is to find people who are less skilled than you. So there is skill in poker, but you have to find people who aren't as good as you. I also examined the relationship of volatility and house edge. Volatility is the bet-to-bet variance. A game like lotteries is very highly volatile. You could win nothing, or you could win $1 million in the next draw. That's a very volatile game. Blackjack, the outcome is almost a 50-50 chance that you're going to win the hand or not win the hand. So it's a very low volatility game. I've also done prevention work. In 2000, developed a 1-hour prevention intervention for youth. Basically taught them about random chance, taught them about coping skills, and we showed that we can teach students, high school students, about coping skills and about random chance. We collaborated that in 2003, 2004 with a more intensive study. 2012 to 14, we tested an electronic app as an educational tool and found that some success with that. And 2014 to 18, evaluated an electronic tutorial for people who reinstate after self-exclusion. In terms of treatment, I've done evaluation of a number of different therapy programs. Most recently developed and evaluated a online therapy for problem gambling And this happened to be, this coincidentally happened just before COVID hit. So that became very important that we had actually tested the feasibility of it, because our therapists at CAMH had a little head start in adapting to the problem of COVID-19. Now, where electronic devices can be helpful in problem gambling, that can be helpful in research, it can be helpful in prevention, it can be helpful in treatment. And so this is where people in this, people who are looking for jobs can find niches for in this field. First, in terms of epidemiological and purposive studies, so basic research studies, running surveys on computers, tablets, and smartphones. Sometimes we have specialized programs for doing that, but sometimes you want to have develop apps that actually are tailored to the specific needs of your research study. There's also an important area in big data linkage. For example, you might want to connect driver's license information with healthcare utilization. So there's opportunities if you understand the area of using computer technology to do big data analysis. I'm also actually preparing a proposal where we're thinking about using data scraping from social media as part of our research approach for that particular project. Online surveys, this one is pretty plain. You can actually make them look quite a lot nicer than this, but this is one of the online surveys I'm using, and it's asked them about, I think it's 11 different types of games that they play, and if they respond, they play a particular game, then the next question comes up. So if they say they play casino table games, then the next question comes up and asking them how often they play the casino table game. I've done several online surveys now, and that's one area. Knowing how to do online surveys, you have to understand a certain amount of Boolean logic for branching logic, because you don't want to give people questions that are not appropriate. If they answer they don't gamble, then you don't want to skip subsequent questions about gambling behavior, because it will annoy people greatly. I've also done research on simulations. In some cases, this is modeling theories. You have a theory. You hear a lot about this if you listen to the climate change data. There's a lot of, you have theories about how various variables work together, and you model it. So if you're a computer, there's a big area of computer programming needed for modeling these data in order to predict what the outcome will be subsequent to this. Testing statistical assumptions. I've actually published papers where I make up big data to test what are the error rates, what is the how valid is this particular model for this data set. And the one I'm going to talk about the most is exploring gambling outcomes, which is a particular area, obviously, since that's my field. This is a program I wrote dating back to 1998. I actually have a background in coding, so it was great use to me. This is looking at 3 different ways of playing roulette. One is constant minimum bets. That's the line that goes pretty much flat across the top there. Randomly varying the bets, which produces a bumpy line up and down, gradual losing because the game's house edge is against you. And then this martingale system. Martingale system is a popular strategy amongst people who gamble, where every time you lose, you double your bets. And this is a common strategy people use when they play table games such as roulette or craps or some of the other table games. I think probably craps if you're doing some of the bets in craps too. But the problem is it works most of the time. That is, you win back your losses soon enough to make up for your losses. But when it fails spectacularly, which is showing you in this graph how the person was winning at first, and then they drop down, and they start winning again, they drop down, they start winning again, they drop down, they winning again, and gradually they're sneaking down into a much larger debt than if they had just been betting the minimum amount. So this demonstrates that the strategy is it sucks you in because it works most of the time. Now this is a screenshot of a program. I programmed this myself in Visual Basic. Unfortunately, my computer programming skills are a little out of date. This is from the early 2000s. This allows me to basically simulate any outcomes of any game. I can vary with up to 8 betting levels, and I can change the payback percentage and the games per minute and so on, and the size of the bets, and I can simulate what the outcome is. And the reason I did this was that I could produce these sorts of graphs. Now, this is a slot machine play in the short term, showing that over 300 course of 300 spins, some people are winning, somewhat more people are losing, but it's really hard to see from this graph what the long-term outcome is going to be. Are people going to win? Are they going to lose? Of course, there is a house edge, so in the long term, they do lose. So I would then run this again with a longer time frame, and I produced this. Now, this is obviously a much, pretty dismal outcome. And this is what happens over 50 hours of play. So even though people can win in the short term, and they can win on slot machines, the longer the play, the less likely they're going to win. And so this is a demonstration of the long-term outcome. It also allowed me to explore the pragmatics of game design. The 2 circles, they show the games that commercial game developers pick peak at around 5 minutes in terms of outcome. That when people are most likely, actually within the first half hour, are about around 30 to 40% likely to be a winner within the first half hour. The longer they play, the less likely they're going to be ahead. And this is a pragmatic game design, because if you're an industry that's making money, you want people to have hope. So you want them to win within the first hour, but you don't want them to win in the long term, because otherwise you will be losing money. So these are pragmatic solutions, and this allows us to understand how these games are designed. Treatment. In terms of treatment, there's a number of things ways in which electronic devices are used. Online assessment tools, again, surveys, online consent, online record keeping and data management, including big data, again. Running assessment, one example is running assessment tools over the internet. This is an assessment tool that I helped develop. This is online. It's inventory gambling situation. The therapist sets the client up to take these questions, and then it spits out an analysis of one of these subscales, and it tells the therapist and the client the nature of their gambling. They don't just gamble randomly. They gamble according to certain patterns. Are they gambling when they're happy, pleasant emotions, or are they gambling more often when they're unhappy? And there are people who do both. There are people who do one or the other, and some people do both. Another area is in self-help tools. You got online self-help tools, online access to mutual aid, things like Gamblers Anonymous. There are apps so people can monitor their gambling urges. These are some of the self-help tools that CAMH has developed. There's an area for making this a lot more exciting and pretty, but they are very available online to anybody free of charge. They're not particularly splashy. So people who are good at designing have a niche that, you know, maybe help them improve the look of these things. This is an app which I helped develop a few years ago. It's called Monitoring Your Gambling Urges. You can download this for free. And it allows people to keep track of what or when they have urges and the circumstances of that urge. And it then feeds that information back to them so that they can understand the nature of their gambling. This is part of a cognitive behavioral approach to addictions. The more you understand an addiction, the better you are at being able to deal with it. For treatment, there are areas where it's good at connecting clients with therapists. Now, the thing is, when treatment is being done over the internet, it has to be, there's special requirements. It has to be encrypted, it has to be private, it has confidential, secure. It also has to be easy to use and reliable. So these are important criteria. You can't just go to a Zoom meeting because that doesn't have the security. This is a picture of our therapists. This is an online treatment program we developed, and there's our therapist talking to a client. We blanked out the screen so you can't see any confidential information there. But this, actually, I think she was just testing the system with one of my assistants. But anyway, we set up this program and developed it and went through all the difficulties, but it gave CAMH a head start in terms of adapting to COVID, where online treatment became the norm, really. For prevention, I've done a number of prevention initiatives. This is one. A person would get a slot machine, would play it, and then they would see the long-term outcomes, and they could vary what the outcome is going to look like. I find that the game itself was a bit too confusing, and the outcomes, people did not just spontaneously pursue this. So I mean, it was successful in terms of an intervention. Uh-oh, what's going on? Okay, it was successful in terms of an intervention, but I wasn't too pleased with the outcome. Now there are other things. This is an online, what do you call it? A chat, online chat group, a social support chat group for people with gambling problems. This one is monitored. There are others that are less, not professionally monitored. This is monitored by a therapist, Richard Wood. And there are other ones that are also available that are monitored by GA members. So this is, again, a device. There are, I couldn't find one that was specific for mobile devices, chats for mobile devices, but this is on the computer. Another approach is blocking gambling sites. This is something that could come up in video game or internet addiction if people have those problems. I don't know of any, but GamStop is specifically to allowing you to exclude yourself from gambling-related internet sites, and same with Block Gambling Web and WebBan. So that's another approach. Some people find those useful, especially if you've just quit gambling and you need to abstain from it. Having one of these blockers on will prevent a person from relapsing. Another approach is normative feedback. I just finally got this this morning from a colleague. This one's for drinking. You compare your drinking to national averages, standards, so that you can then get feedback about whether you're drinking too much. Most people who drink too much alcohol actually think it's normal. They actually think the amount they drink is normal. And when you compare it with national averages, it turns out that they're actually drinking more than most people. So this is this helps people get a better sense of their excessive involvement. And you see there are ones for cannabis. I'm not sure, I haven't looked at all these, but smoking, gambling, depression, anxiety, and the concussions. So you can find out what other people are like and comparing yourself. Now, it has been shown that drinking, I don't know about the others, but drinking, people will actually improve their understanding of what normal drinking is after taking this quiz. And so it's had some success as a prevention tool. They then give you a number of pages of normative feedback, and I score in the white quadrant there that I drink a little more than average, because about almost 43% of the population don't drink at all. But I'm not in the problem range, and it gives me feedback that my drinking was not out of control. So that's good to know. I didn't think it was. Managing your gambling. This is actually from OLG. They have this on their online gambling website. They have 4 tools currently allow people to limit the amount they gamble. So they can still gamble. I have a 7-day deposit limit of $100. There's no way I'm ever going to put that much money into their website. I do gamble, by the way. Just I don't waste money. I don't spend a lot of money on it, but I actually enjoy playing poker. But I have time playing this. Reminds me after 5 hours that I've been playing for 5 hours. I might reset that to a shorter time limit. That's something that could apply to video games, because a lot of people who play video games lose track of time, and they'll end up playing until like 7 in the morning and go, oh, I got to work in 2 hours. Oh yeah, that's me anyway. I play video games a lot. Well, I used to. I don't play them this much. But anyway, this allows people to manage their gambling. It doesn't assume they have a problem. It just assumes that people don't want to spend more money than they can afford. And so this is a way of limiting, because when people get excited, they maybe start spending more. The last thing I'm going to talk about, and this is by OLG, which is great, and it's free. It's if you gamble on OLG, they have the site. They have a bit more responsible gambling tools than some of the other gray market sites, from the Caribbean or wherever you're playing. This is a cartoon I made. It's for a current intervention that I'm working on with Professor Farajani at Seneca. And we're developing this way of teaching people about gambling, just to see if an educational intervention will have any success. We have some cartoons. We have some questions and answers. Now, these actually come up one at a time. So if you've lost several games in a row, your likelihood of winning or losing does not change. That, in fact, is true. And if you answer it as false, you get the first response, which is this is in fact true. If you say that it's true, you get congratulations, this is in fact true. So these come up again with Boolean logic. Depending on what you say, what you give as an answer, it will give you then feedback, and it'll ask you if this is helpful. So that we're exploring the possibility of information-based intervention. And you get the next question. If you flip a coin thousands of times on average, you'll get the same number of heads and tails. This is also true and explains why, and so on. So you go through this and teach people about how random chance. And some of the things about random chance are quite weird. This is another cartoon. It's to illustrate the idea, and I painted this myself. It's the idea that random chance will sometimes form patterns. It will do weird things. There was a lottery ticket that was 1, 2, 3, 4, 10, 20. That actually came up as a lottery draw in Ontario a few years back. So this is a demonstration. What the first person says, this is where we generate the random numbers. And the other person says, that doesn't look random. Well, that's what random chance is like. You never know. And this is, again, illustrating that random chance does this. We also brought in this idea of volatility. We made a little video about volatility and showing that in the short term, you can't tell whether you're going to win or not. The long term, the outcome is quite dismal. So we have a little video that illustrates that. And I don't know, am I out of time now? I think I'm running out of time. Okay, so these are just some of the applications of technology to problem gambling. This could be expanded to video gaming or excessive internet use. There are many other opportunities for self-help applications in mental health and physical health as well. So, you know, there's the area is wide open. There's survey construction, big data analysis, apps, mental health and physical health apps. You know, things like encouraging people to live healthy, monitoring their diet, monitoring their health. So there's lots of opportunities for in the healthcare sector for people with a background in electronics. So that's basically my presentation. So how do I unshare? Yeah.
Thank you very much. I understand. I probably during this pandemic, like these problem behaviors like gambling especially have like really become more prominent for a lot of people.
Well, that's the mental health problems have definitely skyrocketed. Depression, anxiety, distress. Video game use has skyrocketed. Alcohol consumption has skyrocketed. Now, gambling, because the casinos have mostly been closed, gambling has actually decreased in general. And the helpline statistics dropped by about 50% initially with the lockdown because the people couldn't get to the casinos. But, so that was the first story. But as time went on, people started taking up online gambling. Now, we don't know how far that's going to go, but there's definitely been a surge in the number of people who are gambling online. Now, online gambling is a bit more problematic because it's available all the time. There's no stopping. Like in a live casino, there's you have to actually go there to the casino and you have to come home. There's a barrier between you and the casino. With online gambling, there's no barrier. We do find that online gamblers tend to be more problematic, but it's not clear if that's because desperate people go online or if online gambling is more addictive. We don't really know. I suspect it's the first one, that people who already have a problem go online. But I mean, that is definitely an area of concern. But it's interesting, it actually has gone down, and at least initially. Whether that's still true, we're not sure. We're you know, as time goes on, we're getting more and more data on the topic to find out if online gambling is now compensating for the fact that the casinos are closed. One other thing is there are people who gamble at the casinos who are actually terrified of what will happen when the casinos open again, because they've stopped gambling because of the pandemic, and they're actually afraid that when the casinos open again, they'll lose control again.
Yeah, I understand. It can be very scary for sure. But thank you for your enlightening presentation on your research that you've been doing like these last 25 years. And we're looking forward to, you know, seeing the solutions for the challenge area that you've helped come up with. So thanks for your involvement in the hackathon in general. We look forward to your mentoring session later today.
Yeah, so what was 1 o'clock, right?
At 1 p.m. Yeah.
Yeah.
So
Great.
thank you, Nigel. To everyone, thanks for coming to day 3 of the hackathon, the activities. Good luck the rest of the way with your projects. Tomorrow at 11 a.m. is the final deadline for submission. So just about 25 hours. So good luck, and I look forward to seeing all of your work. Yeah, don't forget to have fun. In terms of this recording, the recording will be posted on the Seneca Hackathon website, so you can look for it there under the Keynote tab. So everyone, thank you for coming, and good luck and have fun.
Do you want me to send you the updated PowerPoint? So that way anybody, you can share it with anybody who wants to
Sure,
see it.
yeah. We
Okay,
could put that up as well with the recording. That would
Okay,
be great. Yeah. Thank you, Nigel.
All right, welcome. Do we have time for questions, or is that finished? Have I overdone it?
No, we'll open it up. Are there any questions? So
For sure.
please put them in the chat.
Sure. Actually, I got one from Vlad, and he was saying how online games use the same model as gambling. It's an easy
Yes.
start, but a hard fall. So that could.
Yes,
what-
that's
yeah.
true, and they're becoming more like gambling because of things like what do you call it, loot boxes and other microtransactions. So that it used to be you'd put money up front, and then you'd be playing for a month or two for free without any additional cost. But now a lot of these games they have microtransactions that increase over time. And there are various ways in which they have implemented this. So it's potentially going to becoming a much more expensive hobby. I was annoyed. I recently bought Total War 3 Kingdoms, and a lot of the characters that are interesting to play, like Meng Hao, I have to pay extra to play that character, which is annoying.
That's how they get you.
Yes, that's right.
Alina is writing here, from the gambling simulation graphs, you could see how it might play your dopamine system.
Yes, they do. In fact, there's been some research that shows that random chance maximizes, more than anything else, maximizes the release of dopamine. It's because our brain is constantly trying to resolve inconsistencies. It's trying to predict what's going on. That's our brain's natural tendency, is to try and figure out what's going on. Gambling or random chance cannot be figured out. It's unreducible. And as a result, and dopamine is part of the learning system. So it allows us to learn new behaviors based on experience. But you can't learn from random chance, other than that you can't win. You cannot predict random chance. So it maximizes the release of dopamine, and it's sort of a frustrated system because our brain can't resolve the randomness.
We have another question here from David, and he says, with the prevalence of games with microtransactions and self-directed investing, do you think it's important to add basic statistics to mandatory curriculum?
Yes, although they actually, that's something we pushed for back in the early 2000s, and we got kids now, I think in grade 5, they take number sense. So there is some basic statistics that are required in school. I don't know about the high school curriculum, whether basic statistics is really pushed there. I was impressed what they did with the grade 5 curriculum. I think it was grade 5. I don't know. That was partly because my research back in the early 2000s was pushing for a better understanding. Kids needed a better understanding of numbers and probabilities and frequencies.
A couple more here. So from Suyash, what actions are the government taking to control gambling?
Well, as I said, you see on the OLG website, they actually do have a number of self-help tools that are available on the government website for gambling. And it's voluntary, but people have the tools that they can use in order to manage the gambling. All the major casinos in Ontario, well, all of them have a self-help. Either have a self-help or a live help person. They call play smart centers. I know these about a lot about these because my wife actually works in one of these PlaySmart centers. Um, and she's at the Ajax Casino. Currently not working because the Ajax Casino is closed. But what she was doing would they would be in this office, and anyone who had a problem, they wanted to self-exclude or they wanted to learn about gambling, come to this office, and she would tell them about how the machines work, give them some self-evaluation tools, some self-help tools, and also refer them to treatment and help resources. They would also go around walk around the casino floor and talk to people about their gambling, and if anyone needed help, they would direct them towards help services. So that's another thing that the government actually is doing, and I quite approve of the PlaySmart centers. In terms of lotteries, one of the things they implemented, I don't know whether this is because I suggested it, but it happened anyway, which is good. When we found out that people who win money are more likely to develop a gambling problem, we recommended that they offer financial planning, information on financial planning services to people who win lotteries, because often what happens with lottery winners is you win a lottery and then you gamble that away and expect to win another lottery. And that usually doesn't happen, although it is possible. So that, some people who win lotteries live happily ever after. Some people who win lotteries gamble it away and then end up even worse off than they were in the start. So that was something that was done in order to help people prevent that cycle from happening. Does that answer the question? Oh, also there's a treatment. There's a free and confidential treatment service in Ontario for people with gambling problems, and a helpline if you have problems. The helpline, there's helplines for mental health and distress, drugs and alcohol problems, and gambling problems. So anyone who has some kind of mental health issue, can call the helpline for help.
Okay, so maybe there's a couple more. So from Ninad, how will do things like nudge theory help to bring about improvement in problem gaming or gambling?
I'm sorry, I have to know more about what nudge theory is. It sounds familiar, but I'm not all that familiar with it.
Okay, so
I have
Ninad, if
left.
you
I have left my email on the PowerPoints, and if they want to email me later, they're welcome to.
sure, yeah,
Part of my job is actually to answer questions for the general public, so that's why I put my email up. I see that there's also a question about is it against the basic interests of companies to sponsor such initiatives? I wanted to answer this one because people like to gamble. I actually gamble myself. I enjoy poker. People like to gamble, and I don't know exactly why people like to gamble. I can't stand slot machines, but I like poker. So having ways of encouraging people to control their gambling and limit their problems actually is beneficial to those people, because if they're gambling anyway, then maybe they should have some way of helping them. If you ban gambling, what happens is criminal organizations then offer gambling, and you'll get less overall gambling when the mafia runs it. But if you do end up, losing your life savings, your consequences might be a little more harsh than when they're legal. So there are pros and cons of having gambling that's legal versus allowing, just having it run illegally. And in one sense, some people are going to be better off with legal gambling, but there are going to be more people who gamble when it's legal. So It's a bit of pros and cons. In terms of, let's see, is it better to develop an internal control system, and how can we promote that? So yeah, it's better if people have self-control. One of the reasons the what's that called, the MyGoo, it's an app. That encourages people to learn self-control through understanding what their actual vulnerabilities are, and that is why a lot of these self-help tools promote in your own personal control over impulses. Let's see.
I think so. I think we'll wrap it up now. I could so you said your email, so we'll post your PowerPoint on the website, and your email is there, and I think students can email you about any additional questions they had there.
Okay, great.
So thank you so much, Nigel.
Thank you.
And again, thanks to everyone for coming.
Appreciate the opportunity, and I'm looking forward to the mentoring session myself, and looking forward to the outcome of the hackathon tomorrow. I think it's a very it's fun to see how innovative young minds will come up with potential solutions.
Definitely.
Yeah.
Definitely. There's a lot of creativity there.
Yeah. Looking forward to it. Right. Okay, so I think I've got other meetings to go to, but I will talk to people this afternoon.
Excellent.
At the mentoring session.
That's
Okay.
fantastic. Fabulous. Thank you so much.
Welcome. Thank you. All right. Well, goodbye. I'm going to go now.